This episode is for general education only, and it is not a medical advice. Viewers should consult a qualified healthcare professional for diagnosis and treatment of any condition.
This is when you need to seek treatment and fix that because it only gets worse. Our chiropractors, we don't do massage. Just people told me that you really like what you're doing.
Okay, it's just I'm tired.
Yeah.
I'm exhausted from blah, 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 blah.
And do not treat pain as a normal thing.
We hear the word wellness everywhere, but when the body is in pain, what actually works? Today on InFocus, we're talking chiropractic care, the small everyday habits that create or relieve discomfort. Welcome back to InFocus. I'm Sakshi, your host, and today we're talking about back pain, posture, everyday habits, and thinking whether it is normal or should I get it checked. So let's get into it. Hi, Dr. Djeddi. How are you?
Hi, good morning. I'm fine, thank you. How about yourself?
I'm good, thank you. Welcome to InFocus. We wanted to start with knowing more about you and your journey in the healthcare industry.
I'm a chiropractor and I am also the clinic owner. We have been in core downtown serving a workforce population since 2008, and in particular at 401 Bay Street. We have been here since 2013, and I am a diversified chiropractor and focuses more on where their pain is coming from and how to fix it and how to be more functional on their day-to-day.
Was there a moment in your journey that shaped how you see healthcare now?
Absolutely. My own personal experience, first of all, one of the reasons I became a chiropractor because of my personal journey. Like many of you office workers, I was in an office environment and I had chronic headaches, and I landed to my mentor clinic a long time ago here in downtown Toronto, Dr. Christian Loin, and that was my first assessment and treatment session, and I was intrigued. I was really fascinated how she holistically fixed my issues in 2 to 3 sessions, and also educated me how to help myself to take control of my pain and my symptoms. And that kind of got me to the point to know more about chiropractic, and I love the natural and holistic approach as opposed to having medications. Of course, when you need medications for certain conditions, you do need it, but for most chronic conditions, medication is not or pain medication is not the solution, because if you don't target to the root cause, the pain will keep coming back, and we are basically dealing with the symptom and patching, not fixing the actual problem. And as a result, I myself, I had medical background, and I did medicine back home too, and I left my office job and I pursued chiropractic, and I love the nature of being sort of, it's an active professions, and it's me being engaged in all day, moving around from treatments to treatment rooms, and also empowering patients to be active and have active lifestyles and change in lifestyles to improve their functions and reduce their chronic pains. And I love it so much myself that most of the time when at the beginning of my practice, people told me that you really like what you're doing. And most of the time the answer was that you don't have to say anything. You transmit your passion through your touch and therapeutic touch, your hands, and that's what we feel. And I said, then you got it.
What is one thing that you wish people knew before they come to your clinic?
One thing I wish people knew coming to my clinic to come a little bit earlier, and do not treat pain as a normal thing. Yes, pain is common, but it shouldn't be treated as normal. And the majority of individuals or patients that I see, they suffer for years or months having this chronic pain and thinking that, okay, could be due to stress or could be related to work or sitting as if it is a normal thing, or take it for granted. And no, if you're hurting, that is a way your body's telling you there's something wrong.
Yeah.
And we all get, I understand, we all get probably some muscle stiffness, tiredness here and there, but it may go away. But any pain that persists and stays for longer, that means it is some mechanical problem, some issue deeper. Could be due to postural, could be due to an impinged nerve. This is when you need to seek treatment and fix that, because it keeps coming back and it's not going to go anywhere.
Yeah.
It only gets worse.
Okay, so you have to give me the hints.
You should do this daily.
What do you mean?
Stretch.
Oh, yes, you got it. It supports your entire body.
Workout.
It is an integral structure or part of your body. Otherwise,
Spine.
yes,
Perfect.
we should all do after a long day of
Workout.
Yeah. No.
No? Relax.
Yes. Out and relax. And this is something you need to pay attention. All of us, we get a lot of straining when we sit for too long. And
Posture.
yeah. Doesn't feel good. You get it in your joints, in your body.
Pain.
Yes.
That's easy. Good. I want the easy ones.
It's upper part of your spine and usually,
Neck.
yeah.
I'm nailing it.
As if you're in my profession.
No.
It feels good on your muscles, a form of soft tissue. People like to go for it.
Massage.
Yeah. Connects your body parts.
Bones.
No, that is the bones are connected.
Joints.
Yeah. Base of your body, and it is strong.
Feet.
Allow muscles and other soft tissue to support. Usually we do a lot of weight-bearing exercises to make it strong.
Back.
And you take a lot of calcium to make it strong.
Spine. No, we did it. Bones.
Yeah.
Bones.
Yes.
Most Canadians go there in the morning to get something so that they can function better.
Thanks to the gym.
No, more like a drink.
A cafe.
Yes, but the name of the cafe.
Starbucks.
More.
Tim Hortons.
Yes. The current season.
Spring.
Yes.
Okay.
How we apologize.
I'm sorry.
Yes.
Yeah.
Tourist attraction.
Oh, Niagara Falls. Okay.
Yes.
Island Homes.
Sweet thing. Canada is popular for this.
Maple syrup?
Yes.
Yeah.
Canadian pop artist.
Justin Bieber.
Yes. Okay. Another tourist attraction, but we have it right here in downtown Toronto.
CN Tower.
CN Tower.
Yay.
If you could give listeners one principle for choosing a provider, chiropractor or otherwise, what should they look for?
Depending on what they're looking for. In general, in my practice, we do have all paramedic services. We have physiotherapy, massage therapy, traditional Chinese medicine practitioner, acupuncturist, naturopath doctor, foot care specialist, all of that, we do have it. But usually when a patient calls or contacts, say that I have this pain, what is your recommendation? So based on that, if it is anything related to spine, skeletal, and any chronic pain, I recommend to see a chiropractor, because your doctors, they understand bone, soft tissue, nerve, and everything. Once they know what's going on with you, whether you want to stay or not, then they can make recommendations for you to proceed, whether it is physio. They really closely work with physiotherapists too. There are times a patient requires both. chiro and physio or chiropractic and massage. And majority of my patients are like that this is when I guide my massage therapist that this is Mr. Smith has this slippage, I did this, you're going to stay away from doing this, but you are okay to do all this type of massage because this is how they benefit the most. So it's important to have a baseline assessment before you proceed seeing a massage therapist. Yeah.
We're gonna jump to rapid fire round now. First thing that comes to your mind.
Okay.
One pain complaint that you hear most often.
Low back pain.
A myth about chiropractic you'd love to retire.
Just chiropractic is just cracking, which is not true.
Neck cracking, harmless habit or risk?
Risk.
One habit that quietly causes problems over time.
Sitting for too long or staying in a posture for prolonged and not in a proper posture.
One posture tip for new parents.
Proper sitting or area of studying for their kids to set up a proper chair and desk. And ask them to move around and stretch often.
One small daily practice that makes a difference.
Stretch. Again, stretch, move around, mobility. We call it in our field, motion is lotion. That's what we believe in.
That's good. Your definition of wellness in one sentence.
Pain-free, strong, and functional.
What is, in your opinion, for the new generations that are increasingly relying on AI for healthcare guidance? What is your opinion for that?
It's a little bit too early to rely on AI, and it is AI, but it's been always around Googling. It's a self-diagnose online. It's sometimes it's terrifying for them, and I really feel for it that some of them come when they the information online it's not medically peer reviewed, or for that reason. If it was all 100% accurate, then we wouldn't be in any offices. Then people have access virtual everywhere and do whatever they want. But self-diagnosis, most of the peer-reviewed documents are locked in databases that we have access and we review. So one of the things to not rely on AI or a self-diagnosis, because those are the worst scenarios given to them that cause a lot of them psychological problems such as panic attack, anxiety, and sometimes they don't even talk about it to their parents, or they don't go to the practitioners to really find out what's that. They kind of stay with it, which impacts their function, their mental and psychological well-being, and there's no reason for that. And I would say they should need they always to seek guidance from professionals to get the proper diagnosis and get it fixed.
What is the difference between chiropractic massage and wellness massage?
Chiropractors, we don't do massage. Yeah, so chiropractic, we are spine specialists. We deal with your backbone, not just backbone, the entire musculoskeletal condition, whether you have knee pain, foot pain, shoulder pain, any pain, we deal with that. We do sometimes some form of soft tissue added with as form of modalities such as active release therapy, which is very scientific based, saying we know exactly where a muscle insertion and attachment is. We shorten it and lengthen and rip off through the fibers. It may seem like a massage to a patient, but it's not a massage. It's a very specific, we go what exactly needed, what is exactly needed. So massage therapists are not doctors or practitioners. They took a couple of years. They just know how to massage your soft tissue, superficial muscles, and they have no idea about your spine. If a pain is coming, say I have had issues, patients not getting off from massage table, and then the massage therapist involves me. That patient had a pinched nerve, and they, of course, massage therapists are not doctors or chiropractors to know the patient had pinched nerve. They felt the tightness on the neck, tried to relax it. As a result, aggravated the nerve more because they put the patient in a certain position, and now the patient had more pain than before. So a lot of the time, there are cases, yes, if you do need massage if you're stiff, and it is for relaxation purpose, or a little bit of soreness out of gym. Let's say you have lactic acid buildup, it's great, you go, it's fine. But if you know it is deep, it is chronic, it keeps happening, it is more likely it's not a massage case. You would have to seek either chiropractic or alternative physio or other therapies to fix it. Most massage therapists are just enough and have knowledge of the soft tissues, not your osseous structures.
A lot of people think that chiropractor, the noise that it makes, it's bone cracking.
Yeah.
What do you have to say for that?
That is one of the misnomers that chiropractic, it's almost understood. It's just that's all we do is adjust in a lame word. Chiropractors are a very, as I said, evidence-based, scientific-based practitioner, holistic practitioners, and the focus is to find the root cause of your pain, focus on that, and how to remove it, and restore your range of motions. And by checking, as I said initially through my assessment, head to toe from your brain function, central nervous function. For example, there are times patients have balance problem or disc dislocation. They can't walk and they have weakness on their legs. We know where it's coming from. And there are times patients have pain on the leg, but the patient comes from up this point. This is what we do. We target everything. We target your musculoskeletal, we decompress nerve, we restore your function. Along with that, of course, bread and butter of chiropractic is adjustment. If adjustment is required, we adjust patients as well.
So I know you mentioned before how important exercising is for somebody. What would you recommend to somebody who doesn't exercise regularly, how to incorporate maybe strength training and stretching into their daily life?
Yeah, they should understand the importance of exercise and consistency. It necessarily doesn't have to for you to most people think of going to the gym exercise to go spend an hour and a half to do 4 or 5 times a week. And the first thing, psychologically, it blocks you because it's a lot of commitment, right? For you to be functional, you need to be consistent. Even 3 times a week, we recommend to do 20 minutes of functional exercise. It doesn't have to be heavy weightlifting. It doesn't have to be running. It doesn't have to be something that you don't enjoy. It could be some functional exercises, stretches, and any form of activity that you enjoy. So if the weather is nice, if you enjoy hiking, I would recommend patients to get out and bike. But in terms of a good question that you brought about strengthening is the key for people who sit long hours. Historically, we know people go to the gym either to really become fit or lose weight, right? But a lot of time I see my tiny patients with so much pain and exercise doesn't make sense to them. I usually explain the importance of strengthening. Strengthening makes you pain-free. Strengthening provides more muscle mass for your joints, and more muscle mass around your joints, less pain. And it also sets you up for future, for you when you grow older and older. This is when your base is important. You do have a base that you can still target. The muscle will have memories, and then you are not in trouble. When you grow older and older, your pain level goes higher and higher, and you'll have more issues.
Thank you so much, Dr. Djeddi, for making it practical and clear for all our listeners and viewers. Before we wrap up, where can people know more about your clinic?
The clinic is in existing in downtown Toronto since 2006. It's been a while. We are one of the oldest clinics. We are on the Simpson Tower, 401 Bay Street on the 12th floor. Anybody can search the clinic downtown. They'll see our information on our website. Our phone number is 416-366-1710, and info@theclinic-toronto.net is our website to contact us and request for any consultations.
Thank you so much, Doctor, for taking out time for us today.
So thank you so much. Thanks for having me.
To everyone watching and listening the episode today, if you know somebody who has been living in pain and calling it normal, share this episode with them. I'm Sakshi, and this was InFocus. See you in the next episode. Till then, stay in focus.